So hello everyone. For this meeting, I am going to talk about the coronavirus. So to start with, we have here our learning objectives that after attending, participant will be able to explain basic facts about SARS-CoV-2 virus and then explain basic facts about the COVID-19 disease. So to start, we have here the pandemic declaration, so which is on March 11, 2020, the World Health Organization characterized the COVID-19 as pandemic, and it has caused severe illness and death, and it features sustained person-to-person spread worldwide, and it possesses an especially high risk for elderly or 60 years old and older, and people with the pre-existing health conditions such as high blood pressure, heart disease, lung diseases, autoimmune disorder, and also our certain workers, or what we call or consider as our frontliners. So in this time of COVID-19 pandemic, as an individual, what can we do, or how would we react in this type of situation? So the very first thing is that we need to be informed and prepared, and also we need to wear a mask, maintain social distancing, wash our hands frequently, and also it is highly encouraged or mandated by the law that we need to have our own handy alcohol-based sanitizer, and to avoid touching our eyes, nose, and mouth, because this is the portal of entry wherein viruses can enter our body. And in times that we are having doubt on our health condition, if we think that we are sick, it is much better that we need to stay at home. No? And also, during every time na we need to cough or sneeze, we must do it in a tissue or in our elbow, or inside the collar of our t-shirt, to avoid it from spreading into some areas or surfaces. And to clean and disinfect frequently touch objects and surfaces such as cell phones, not only cell phones, but also in public places like sa mga doorknobs, no button kang elevator. So that's it. And we also have here, I also included the 5 steps of proper hand washing, because it is really encouraged to everyone to have a frequent hand hygiene. So we need to wet our hands with clean running water. Then we need to rub them together with a soap and lather your backs of your hands, between your fingers, and also under your nails. So we need to scrub our hands for at least 20 seconds. No, we don't need a timer, because we can hum or sing in our mind the happy birthday song twice now. And then we need to rinse our hand under clean and running water again. And we need to dry our hands using a clean towel or air dry them. So we have here, to start with the main topic for this discussion, we have here the coronavirus disease 2019. So for the background of this, coronavirus are a large family of viruses that can cause illnesses in animals or humans. So in humans, there are several known coronavirus that causes respiratory infection. These coronaviruses ranges from the common cold to more severe diseases such as acute respiratory syndrome or SARS, Middle East Respiratory Syndrome, or what we know as MERS, and also we have right now the COVID-19. So what is SARS-CoV-2? So SARS-CoV-2 is the viruses that cause the coronavirus diseases or the COVID-19, and SARS meaning severe acute respiratory distress syndrome. So it spreads easily from person to person and little, if any, humans. No. And then we have here for the transmission, the COVID-19 is spread from person to person mainly through coughing, sneezing, and talking, and even breathing. And it is sometimes caused by droplet, which is the respiratory secretion from coughing or sneezing. No, it is landing on mucosal surfaces or the portal of entry, which includes our nose, mouth, and our eyes. So we have the term aerosol. So it is a definition of this is it is a solid particle or liquid droplet which is being suspended in air. And also, COVID-19 can be transmitted to contacts, like touching the person with SARS-CoV-2 viruses on it, and then touching your mouth, nose, or eye. So that is, it is highly encouraged to perform hand hygiene. And also, there's some other possible routes, like fecal matter. So the incubation period of this is that the incubation period is the time between exposure to a virus and the onset of the symptoms. So with COVID-19 symptoms may show 2 to 14 days after exposure, and also CDC indicates that people are most contagious when they are most symptomatic. And several studies show that people may be contagious before developing symptoms. So COVID-19 can cause mild to severe symptoms. So for the most common symptoms may include fever, cough, shortness of breath, and other symptoms may also include sore throat, runny or stuffy nose, body aches, headaches, chills, fatigue, gastrointestinal like diarrhea and nausea, and also the common is the loss of smell and also taste. So for the severe symptoms, it is one of the emergency warning signs of for COVID-19. So most people with mild symptoms should recover at home and not to go hospital or emergency rooms. The reason of this is not to spread the virus contagiously. So the very important thing that they need to do is to get medical attention immediately if they have like difficulty of breathing or shortness of breath, persistent pain or pressure in the chest or chest pain, and new confusion or inability to arouse, and the bluish lips or face now. So what is a person under investigation? A person has both consistent signs or symptoms and risk factors as follow. So we have here the first one is the suspect case. So this is or these are the people who are potentially exposed to within 14 days before the onset of symptoms like cough, fever, and shortness of breath. And when we say confirmed case, it is a confirmed case, or those are the suspect case, which is being confirmed by the laboratory result, which having the positive of SARS-CoV-2 virus infection. So how long does SARS-CoV-2 survive outside the body? So it is not clear yet how long the coronavirus can live in surfaces, but it seems to behave like other coronaviruses. So virus may present on surface for a few hours up to several days, depending on the condition and the type of the surface. So increased risk of severe illness. COVID-19 poses a greater risk for severe illness for people with underlying health condition, like people with heart diseases, lung diseases such as asthma, diabetes, and those who are having a suppressed immune system. So that is why very advisable niya to our older people or to our oldies na you should not allow to go outside, especially in this times of pandemic. So we have also here the IPC for the COVID-19. So what is IPC? IPC is also known for infection prevention and control. So it is the practice of preventing or stopping the spread of infection during healthcare delivery in facilities like hospital, outpatient clinics, dialysis centers, long-term care facilities, or even traditional practitioners. So IPC is a critical part of healthcare system, strengthened and must be a priority to protect patient and healthcare workers. So in the context of COVID-19, the IPC goal is to support the maintenance of essential healthcare services by containing and preventing COVID-19 transmission within healthcare facilities to keep patient and healthcare workers healthy and safe. So we also have here our COVID-19 IPC priorities. So the first one is we have here the rapid infection of suspect cases like screening, triage at initial healthcare facility encounter, and rapid implementation of source control, and also limiting the entry of healthcare workers and or visitors with suspected or confirmed COVID-19. And the next is immediate isolation and referral for testing, like those who are group of patients with suspected or confirmed COVID-19 and separately. The third one is safe clinical management, like immediate identification of inpatient and healthcare workers with suspected COVID-19, and adherence to IPC practices like appropriate use of personal protective equipment. Like we can notice nowadays, our healthcare workers today, their body is really covered with personal protective equipment. And it is so sad realizing how hard or frustrated it is for them. Like try to imagine, no, as a healthcare worker, you are going to wear bundles of protective equipment just in order to protect yourself and to protect the patient. So salute to our frontliners for doing their best now. And also nowadays, we also have also existing a lot of different COVID-19 vaccines. So it is very encouraged or highly encouraged everyone is to have the vaccine. This is to not to protect only ourselves, but also to protect the people around us, especially our families now. So we have here the different COVID-19 vaccine. So the best COVID-19 vaccine is the first one that is available to you. So like nowadays there are some COVID vaccine which is being questioned by some people. No, so it is not necessary that you need to select what kind of vaccine you use, because you do not need to wait for a specific brand, because all currently authorized and recommended COVID-19 vaccine are all safe, effective, and of course, they will going to reduce the risk of severe illnesses. And for here, we also have here, I included some of the most common vaccine brand names. We have here the Pfizer or BioNTech. So this is for people who can get this from people who are 12 years and older, and it is being administered 2 shots. So they will be considered as fully vaccinated and given 3 weeks or 21 days, apart 2 weeks after the second shot. We also have here the Moderna. So this is for people also, for those who are 18 years old and older. It is also given 2 shots, now given 4 weeks and then 28 days apart. And it will be considered as fully vaccinated if the person or the injected person who is 2 weeks after the second shot. So the last one is the most common right now. So which is the Johnson and Johnson or the Johnson. So it is can be given, or it is can be given for those who are 18 years old and older. But this one, it is also administered only 1 shot, and you will be considered as fully vaccinated if you are after 2 weeks. The first shot or that 1 shot of the Johnson and Johnson vaccine was being administered or given to you by the rural health unit or those our frontliners. So that's it. Thank you for listening and for attending my presentation. So this is where our meeting ends. I hope you have having a nice day. God bless and keep safe.